Here at the West Virginia University Heart and Vascular Institute, we take care of a number of patients with aneurysm or dissection disease of their aorta. The aorta is the main blood vessel that attaches to the heart and carries blood out to the rest of the body. Certain genetic syndromes or with chronic high blood pressure, patients can get dilations of the aorta, either where it attaches to the heart or between the heart and the branches that go to the brain. The treatment for this is open heart surgery to replace the diseased aorta. Now, there are a number of guidelines that help us decide when patients meet criteria to have aortic replacement. Depending on your pathology and the size of your aorta will determine when and if you need heart surgery for your aorta. We perform replacement of the aorta in order to reduce the risk of rupture or dissection. As the aorta becomes more dilated, the walls can thin out, and this will put patients at risk for rupture or aortic dissection, where the walls of the aorta tear, and this causes poor blood flow to parts of the body and requires emergency open heart surgery to repair. Depending on where the pathology is within your aorta will determine what type of operation we perform. Sometimes this operation can include repair or replacement of the aortic valve if the pathology involves the root of the aorta where it attaches to the heart. If this is not involved, sometimes we can replace only the middle portion of the aorta between the heart and the branches to the brain. However, when the arch of the aorta, or the portion of the aorta that gives off the branches to the brain, has pathology, either dilation or dissection, we also have to perform surgery on the aortic arch, which sometimes requires incisions either over the right clavicle or sometimes in the groin in order to be able to do the surgery safely. When we're performing surgery on the aorta, depending on which portions require repair or replacement will determine how long the operation takes. But typically, if we have to repair or replace both the root and the arch of the aorta, these operations can take 6 to 8 or sometimes even longer in order to safely perform the repair. It's important to remember as a loved family member or loved one that longer surgery does not necessarily mean a problem. We just want to take our time and take good care of your loved one while we're performing their operation. Recovery after open aortic surgery varies depending on what portion of the aorta we need to replace and how extensive your operation was. But typically, patients will spend a couple nights in the ICU and about a week in the hospital. A lot of times a little bit less, between 4 or 5 days, depending on your post-operative course and your other medical problems. A majority of patients are able to go home after they are discharged from the hospital. However, our physical therapists and occupational therapists, as well as our exercise specialists, will work with you every day and help make the decision about what's the safest option for you. Once you get home, we do want you up and moving around. However, it is very normal to have fatigue and need an afternoon cat nap for the first 4 to 6 weeks. But this will improve with time. Your body is running a marathon every day to recover from the heart surgery that you've had. The main limitation after heart surgery is no heavy lifting until the bone heals. This takes approximately 12 weeks. However, most patients, when they follow up in clinic around the 4-week mark, are not only feeling much better, the fatigue has passed, they are up and about, that we allow them to return to driving and most of their daily activities. The main limitation that remains is the heavy lifting restriction until the bone heals. After your follow-up visit, most folks begin cardiac rehab which is typically an 8-week program where you go 2 or 3 times a week to an outpatient cardiac rehab close to your home and have a monitored exercise program to build your endurance with the security of knowing your heart is monitored and that you're safe as you escalate up on your activities. The risks are actually able to be calculated using the Society of Thoracic Surgeons risk calculator based on your specific risks, what other medical problems you have, and your age and other information. Typical patients who undergo this procedure, a risk of mortality or a risk of dying from surgery or within the first 30 days is typically between 1 and 2%. I know we covered a lot of information today, and a lot of the things that I talked about are a little bit scary, and that's okay. Hopefully this is the only time you will ever have to have heart surgery, but this is what we do every day, and we're going to take really good care of you.